You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. With us, we have an expert on the topic. He is New Jersey's dentist, Dr. John Minichetti. Dr. Minichetti, welcome to the program.
Thank you for having me, Randy.
All right, now, those are pretty dramatic photos, so we'll get to as many of those as we can.
Okay.
Now, for people that don't know your practice, like who's the typical patient that you see?
You know, there's probably no typical patient because I'm a general dentist by trade, even though I have a lot of training in implant dentistry, and that's our field of knowledge and skill. But we have patients all ages, young patients, maybe they're missing a tooth by birth and they're going through orthodontic treatment, need a tooth replacement. We have some elderly patients, maybe they've been wearing a denture for years and they just can't tolerate the denture anymore. So we have a full spectrum of patients that we treat. They come from all different careers and disciplines, from soccer moms, policemen, firemen. I have jazz musicians. I have business people who have no time. So we cater to all types of patients. So there's really no typical patient in our practice.
Okay, now we've talked on the telephone that it seems like you attract people that their mouths, their teeth are pretty bad. Yeah. And you see some, you're able to, you never can be too far gone, you say.
No, never can be too far gone. You know, as bad as some people think their mouths are, it's a common thing. They get in my office and they say, gee, doc, have you ever seen anything this bad? And I say, yeah, I've seen worse, probably like an hour before you got here. So It kind of puts them at ease because that's our thing. We do treat full mouth reconstructive cases. I've been doing implant dentistry for a number of years, and I teach, and I also sit on the board of examiners. So I have a lot of comprehensive knowledge on restoring a patient's smile.
Now this term, full mouth reconstruction, which is what today's topic is, does that mean like what? Like a working definition of full mouth reconstruction?
Well, the full mouth reconstruction, not to be too scary, it's a smile design. It's a smile makeover. It's evaluating the patient as a whole. They're full facial form. When you think about it, Da Vinci talked about the equal thirds of the face, the forehead, the mid face, the bottom face, and the space between your chin and nose, how symmetrical you look. So when I evaluate patients, one of the first things, give me a smile. I want to see how they look. Is it straight? Are they showing their gums? Is it canted? Do they have spacing? From there, we talk about tooth positioning. From there, we talk about the base, how strong it is. And then we talk about what options they have to restore their smile.
Now, what about people that have really bad gums? I mean, their teeth are just failing. You can help those people too?
For sure. Don't forget, the majority of people will lose their teeth due to periodontal disease. That's the disease where bacteria eat away the bone. Usually these patients can still be good candidates for implants. Most of our implant studies are on patients that have periodontal disease. So that's a very common cause for people to seek our treatment.
So let's start with some of these photos, these full mouth reconstruction, full mouth makeover cases.
Sure, let me show you one. So, that patient is Daniela. Now, Daniela's story, she's from Eastern Europe. Okay, she meets her boyfriend, they get married, he brings her to the United States. She's had some bad experiences. Think of Eastern Europe. These are areas where they didn't have local anesthesia, no Novocaine. Terrified of the dentist, literally terrified. Missing teeth. I remember the first time Tom, who was a patient of mine, brought her to the office. He said, I'm here for my consultation. I said, okay, where's your wife? I want to meet her. She's out in the hallway. She was too afraid to come into the waiting room.
Like ashamed of her smile?
No, she was just so nervous to meet me and everything. Okay. Ashamed of her smile is the one issue, but she's terrified to actually meet a dentist.
All right.
So we brought her in, just spoke in my office, and I analyzed her. And it took a visit or two, a couple of consultations. So Daniela doesn't like her smile. She feels like she's not showing enough of her teeth.
Like she didn't smile at all?
She kept covering her mouth. She was too embarrassed of her mouth. She had missing teeth. She was embarrassed of that. Her bite was off, so she was embarrassed of that.
What do you mean her bite was off?
Well, because she was missing her teeth, it was kind of moved to the front. You get that prognathism.
Okay.
Or you're biting out, you're compensating. The teeth aren't meeting properly because she's got so many missing back teeth.
All right.
And just afraid to smile for patients, for people. She just was not comfortable with it.
So when you look at her on the console, like what do you see as a dentist?
So actually with this type of patient, I could see this as a home run because she doesn't have to lose all her teeth. I can keep her teeth. Because we work as a team, I have an orthodontist that I did a consultation with. We reestablished her bite. We used dental implants to reestablish her bite by replacing her back teeth.
Okay.
And it gives good anchors for the orthodontist to finish the orthodontic treatment. Once she was in the proper position, I restored her entire smile with crowns and veneers for her front teeth, keeping a natural look. She was so happy with her new smile. In fact, from there, they ended up moving to Florida. She opened up a restaurant. And we did quite well. I went down there. It was in Sarasota.
All because of her teeth.
Yeah, I think it's due to her teeth. But I do remember Sarasota. They had those little bugs on that week where we were there outside, and it was wonderful, wonderful place, wonderful person.
So she looks good.
Yes, she worked for the airlines industry after that because Tom was in the airline business and as a stewardess. It was a home run case. So if you take a look at her smile before and after, you could see the remarkable difference. Although she's smiling in the picture before, it's kind of a hidden smile reserve. She's a pretty woman to begin with, but afterwards, because of the change in her smile, it's more symmetrical. She has the incisal edge that we're looking for. She has a nice broad smile. She's now wearing makeup. Her hair's different. Her husband is ecstatic over the way she looks. He's so happy he brought her.
So really, I mean, it restores self-confidence to these people.
All the time, people, if they feel comfortable with their smile, they're not afraid to do things, okay? Because they have confidence in themselves and they can now jump out there in the real world. Better at job interviews, better at business ventures, better at work, better at interpersonal relationships, more comfortable. Everybody today's on whatever, .com this, going on dating. If you don't have good-looking teeth, you can't possibly have confidence to go out and meet new people. You're going to be embarrassed of these things.
So we should mention, I mean, the things we're talking about on the show,
Yes.
you teach dentists from all over the country.
Yes.
Is that right? You're past president
Yes.
of the American Academy of Implant Dentistry.
Yes.
You sit on the board. I mean, you're here this week in California.
Teaching a course, yeah.
And what's that about?
Well, I've been involved with implant dentistry for really 30 years. So I was involved at the early stages. And from there, I got tons of education. Like every course I could possibly take. I became credentialed with the Academy because of my experience. And we've set certain levels across the country of board certification. Because implant dentistry is such a multidisciplinary field. There's so many parts to it. You have orthodontic treatment, you have prosthetic treatment, smile designs, you have surgery. Because it has so many parts and pieces, those doctors that can understand all the intricacies of these parts become better clinicians.
So the people that we're talking about today, which is what we call full mouth reconstruction, I mean, you're rebuilding their whole mouths.
Yes.
These are people that you're saving a lot of their teeth. Some people are getting some veneers, like cosmetic stuff,
Absolutely.
in combination with maybe filling in some holes with implants.
You know, some patients think that they're too far gone, and that's not necessarily always the case. They start self-diagnosing themselves. Oh, whatever, I have no more bone left. That's not necessarily the case. Each case is individually analyzed. Sometimes it's best to keep the teeth because they'll have the best support and the best facial structure rather than just totally taking out all of their teeth and giving them this blob denture. So for some patients, if they have a denture already, they need implants. So those are the differences in these types of cases.
Now, for these kind of smile makeovers where you're doing a combination of procedures, because you teach this internationally, I guess, does it cost more to go to a guy like you?
I wish it did, but it doesn't. Just a joke there. In actuality, it doesn't cost more. In fact, sometimes it's more reasonable. Why? The trend has been over the years. Surgeon does this part, a restorative doctor does this part. The patient goes from office to office. They have to meet new staff. They have to be comfortable with that doctor. Patients and the dentist-patient relationship is a close one. And if you can go to someone who's skilled, or even a team, even in my own office, I have an orthodontic specialist, I have an anesthesiologist, because we obviously can't do everything ourselves. But if things are well within the same roof, we can save time, and time is always money for patients.
Okay.
So in that aspect, you can actually save some expense, but our fees are
So you have this
really
concept. So you do everything right there. So you do, some of the surgeries, you do the cosmetic dentistry, you do the sedation, all right there.
We have our own ceramists. We have a couple of ceramists in the lab making porcelain ceramics.
What were you going to tell me about that?
I kept that one a secret. We do. We make veneers and we make porcelain crowns right in our office.
All right there. Now you have more photos. What else?
I sure do. This is an interesting one. Sandra. Sandra's a sweetheart. So Sandra came to us for cosmetics. Some people come to us for function. Some people come to us for cosmetics.
What do you mean function?
They can't chew. They can't eat anymore.
Okay.
They just can't bite into a sandwich. It takes them forever to eat. They can't order a salad anymore. They can't cut it. But Sandra was on the other aspect. Her teeth were not that loose or not that many missing that she couldn't eat. And so Sandra has kind of like a grimace smile when she comes in. She's not happy with it. She has to accentuate it. She never does it.
So you have to make her smile.
Yeah, I have to say, raise your lip, raise your lip, raise your lip, because we're evaluating all her soft tissues, etc. So she's really bothered by the smile. She mentioned a story where she's a violinist, she's a teacher, she works with children. She had the opportunity to do a session, and she noticed that one of the children came to her. When she smiled, they backed away, and she didn't forget that. And there was another incident where she was up for a position, a gig, they call it the gigs, and she was with Mark Anthony, one of the musicians, and when they put them all together, they moved her to the third row, and she felt that was because of her smile. Because of her smile. And so that was the game breaker for her, she said. She came in and she said, that's it, I got to address this smile. So she came to see us on a recommendation of another jazz musician.
So do you get excited, like when you see this, you go, oh boy, this is going to be good?
Yeah,
Like you see the end result?
Absolutely. I mean, I know it's a challenge because there's a number of ways you can handle it. So that's the number one thing. We're going to analyze it and go over the options on how we can handle it. Because we could have handled it with orthodontics. We could have handled it with taking out all her teeth. Now, there are some centers that would just take out all of her teeth and remove a lot of bone and tissue and just give her a denture-looking type bridge.
Okay.
You know, a more aesthetic result and a more functional and natural, because you still have the sensation when you keep your teeth. You have sensation in your teeth, which you don't have in your implants.
All right.
Is to keep some of her teeth and then place implants in the appropriate area. And that's what we did for her. We removed some of the teeth that needed to be replaced. That allowed us to line up her midline so she had a better center. And then we also had to position her gums in the proper position so when she smiles, she gets that cosmetic look. You know, that look on the Cosmopolitan cover of all those young models.
Okay.
When they smile, it goes right to the edge of their gums, right to the perfect length. And that's really an art. It's a science, but it's an art too. Now take a look at this after. What you'll notice here is that when she smiles, it's a much more controlled smile. It's not a forced smile anymore. She's happy with that smile. It's a natural smile. That smile, that lip line goes right to the edge. She just shows the little tip of her pupils, and that's real gum. That's not pink porcelain. That's not pink acrylic. That's real gum. It takes a real lot of measurement.
Good.
Oh, it looks really good. So it's
Are those veneers or what are they?
Those are actually crowns on implants. So those
Okay.
are implants with crowns on them. Yeah.
Okay.
Porcelain crowns. Yeah. The teeth fall perfectly on her lower lip also.
On the before photo. Okay.
Yeah, absolutely. It'll fall right on her lip. It's contoured to her face. These are crowns that are cosmetically placed. Now, I told you she was a violin player. So she recently came in and she told us that now she's busy. You're busy, she's got a lot more work. And she doesn't know what it is, but she thinks it's the confidence she has from her teeth. She just feels, she said, I feel this aura about me. I'm so confident, I'm playing better. Now, trust me, she plays a violin. It's not like one of our jazz musicians who plays a horn or a trumpet.
Okay.
So it's not a functional thing, but it's how she feels about herself. It's an emotional thing. She plays, she's smiling while she plays, she's getting more teaching jobs. It's really, she's ecstatic about it.
Is this one of those things where they go, I wish I'd have done this years ago?
Absolutely, she said that.
And she did.
There's a lot of truth to that, because if we do catch them early on, sometimes we could save some of these teeth. Sometimes the treatment is easier for them. So it's not a bad idea to come in as soon as you can to get treatment for these cases.
Okay, so we're gonna take a quick break. We come back and we'll go more of this photos and also kind of take me through that consultation process, what they could expect. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
My name is Fred. I always had a problem with my teeth. My teeth, when I was growing up, I didn't have a toothbrush, so I never really learned proper dental care. I got to the point where I was not only embarrassed, I can't even eat properly. Or dinner would take me like an hour to eat dinner. It was the best money I've spent in years. I bought cars, I bought everything. This is life-changing. It was life-changing.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, we're talking about rebuilding mouths, full mouth smile makeovers. And according to my first guest, he says you're never too far gone. Your teeth are never too bad. Your gums are never too bad to have the smile you've always wanted. With us, we have New Jersey's dentist, Dr. John Minichetti. Okay, Dr. Minichetti,
Hey.
welcome back to the program.
Thanks.
Now, so are there that many people that just really hate their smile?
Oh yeah, there's a lot of people out there that hate to smile.
Can you spot them?
Well, you can tell, you can tell patients because they look very serious. They don't smile. Some of them, the females will cover their mouth when they laugh. They cover their mouth because they don't want their lip to go up. And you see it every day, walking down the streets. If those people who are very serious, those are people that don't like their smile. They appear to be mean or mad or upset about something. You know, you go to another country, you don't speak the language. You walk down the street, if people are smiling at you, you get a good feeling, a feeling of safety. A feeling of friendliness. If you walk down that street, everybody's serious, you're like, uh-oh, what's going on? Even without the language, the smile is so strong.
But you're a dentist. Doesn't surprise me you say that. That the smile is the most important thing.
Well, it's not me, it's the studies that show that. When you think about it, 90% of your body's covered by clothing. So what do you see? You see your head. And from your head, the center of your face is your smile. 75% of the time, your eyes are directed right to the smile. So it's the number one thing. Talk about first impressions. The study shows 17 seconds you're going to make an impression. First impression on a person. That smile is a part of that.
So what's your take? Okay, if so many people don't like their smile, they've got a lot of problems,
Yeah.
and maybe they have the money or the means to do it. Why aren't they doing it? Just the
That
fear of
comes
the
from
dentist?
the number one thing may be the fear of the dentist, but there's a number of reasons. Number one, they haven't been in the dental loop because it hurts. You know, they've been going to the dentist for so many years, people with bad teeth, toothache after toothache, root canal, lose a tooth. It's been a terrible experience. They're throwing their money away for nothing. You know, they just got that bridge. They've spent thousands of dollars and then that went bad 2-3 years later. So it's on and on and on. They just had it with the dentist. That's one of the big reasons.
Do you hear that? Like, no offense, doctor?
Absolutely, and I understand if you're going to get tortured every time, it's not fun. I can understand that. Okay.
Well, then how is your practice any different?
My practice. Well, how is our practice different? You know, because sometimes the patients get to the point where they said is enough is enough. I've had some patients say, you know, that last tooth that broke, I had to make a decision. I wasn't going to do this anymore.
Okay.
And then once they made that decision and got turned over, took care of their teeth, and or removed their teeth and had dental implants. I mean, I have one patient say, now that I got the dental implants, I haven't had a toothache since.
Okay.
Think about that. That's huge for this patient. Have you ever had a toothache? For those of us who had, it's debilitating. They compare it to kidney stones. I mean, it's horrible. And you know, what are you going to do? Take pain medication? You're going to constantly go to the dentist to get things fixed? You just don't want to deal with it. So if you can get it corrected properly, you're in a better position. Here's another example.
All right. Oh, my goodness.
Yeah, that's my buddy Kevin. Kevin.
But that's got to be unusual.
You know, it's really not that unusual for our type of practice because these type of patients will seek our care. You know, we do a lot of the bigger cases and we have referrals from other doctors, et cetera, to get these bigger cases. Well, you know what? The reason you don't see it, and actually they don't see it because they never smile. They just keep their lips closed or they cover their mouth.
Smile.
They don't.
Yeah, that's a
They've
good point.
avoided it their whole life. Yeah.
So when you see this, what are his options?
Well, Kevin's options, his teeth were a little bit too far gone. So, you know, he had a whole history. He remembers as a child, he was in a little bicycle accident. He said, oh, it all started when I was 13. He had his teeth pushed up into his jaw. They tried to wire the teeth together. This is, you know, 30, 40 years ago at least. They failed. He needed root canals. They had to be pulled. Now he's in middle school, high school with bad teeth. You know, he just was, it's the same story to how disgusted he was with dental treatment over the years. Just avoided the dentist. He decided he wanted to make a change in his life. Some personal things were happening. He wanted to actually start seeing some people, you know, because he's lonely. So because of that decision, he sought some opinion on what we could do for him. So in one afternoon, we gave him a new smile. Now here's a guy who could hardly eat and chew. And so besides giving him teeth that he could finally eat with, he got a new smile too. It's a win-win.
Very nice. Changes his appearance completely.
Oh, for sure. He's so much more confident. He's dating now. It's wonderful. Here's another patient. Now, this particular patient, John, I remember John. John was, you know, men tend to be a little bit timid in seeking medical or dental care.
We put it off.
Yeah, they sure do. Okay. Women are usually the caregivers in the relationship. So I remember his first comment when he came in. He told me that you know, my wife says, you got to get your teeth fixed because our daughter's getting married in 2 months and you cannot look like this. Okay, he was getting by with some very poor teeth. So his daughter's getting married in 2 months. So in one afternoon, we gave him a new smile. He needed something to go to that party, look his best. His wife was ecstatic. In fact, his wife became a patient. Here's another patient of ours, Fred.
All right. Oh my goodness.
Now, Fred smiled, but when he smiled, it just was not attractive to him. I mean, you know, he told me a story that people thought he was a tough guy because he had a rough smile, you know, just like they talked about in Hollywood. You want to look tough? You know, people were afraid of him. He probably was a tough guy. He's a carpenter by trade. He works with his son. And I remember him telling the story of why. You know, he said, I want to get new teeth because I can't eat. He said he went out for pizza on the way home with his son, who's 26 at the time. His son had 2 slices and he's still biting like this second or third bite. He was totally disgusted. And then one of his tooth broke off. And he said that was the last straw. So when that tooth broke off, that was the last straw for him. So he did some research, he said. He looked at some of the centers in the area. I do remember that. And he came into our office and he kind of interviewed us, felt this out.
Yeah.
And he decided to go ahead in our office. And he said he's never had a regret. He's wearing some removable dentures that are snap-on.
Okay.
And he says he has no more pain anymore. Before he got, and he was worried about that because people told him about dentures, you're going to have pain. He says he has no pain with the dentures. In fact, he wears them just about all the time, even though we tell him to give the tissues a rest an hour. He sleeps with them, wears them all the time. He can eat whatever he wants. He's eating corn on the cob, steak, no problem.
So with a snap in, snap out
He's
set of
eating
dentures,
corn,
he can eat whatever he wants.
He's eating everything. He told me corn on the cob, steak, whatever he wants, and he has no more pain. The dentures don't bother him, and no more toothaches. That's the best part, because he's constantly having a toothache his whole life. One of those stories that the guy just keeps going to the dentist, getting tortured. It's over for him. Finally, he's relieved of his pain.
I mean, it looks completely different.
And the bonus is, everybody says he's got a nice looking smile.
So when I look at that before photo,
Yeah.
I mean, is that considered gum disease?
Yes, that's periodontal disease, where you see that recession, where you see the roots of the teeth showing, and there's all plaque and bacteria there. It's not good for your health either. Think about it. The same plaque that causes cardiovascular disease, heart disease, diabetes, it's all interrelated. These patients, we clean them up by removing those hopeless teeth. There's no more signs of infection. It's better for their health. He actually put on 20 pounds after
Is that right?
He told me that, 20 pounds.
Well, he doesn't look like a tough guy anymore.
He did say that. The only bad thing is I don't look like a tough guy anymore, but I can hold my own. So that was pretty funny. Yeah.
Okay, good. Now, I know you have more photos. We're going to take another break.
Okay.
We'll come back and take a look at those. You're watching The Wellness Hour. We'll be right back.
I really couldn't eat very well. Couldn't bite into an apple. Either I'd catch a tooth or it would break. It changed my life tremendously. I could eat what I want and not have to worry about having a problem with my teeth. You could open your mouth, you could smile, and, it's all good, There is no downside to this at all, none whatsoever. It was probably one of the best decisions I made in my life.
Eating was a problem, chewing, getting the small bites, and I didn't feel good about it. I mean, I went for a couple of years without hardly smiling at all. And I'm very happy with the way it turned out. My work has increased, I get called, I'm doing stories. It's really nice that I can feel confident, I can embrace children when they come up, when I'm playing, and I could actually chew with nothing moving. It was like, wow. And I'm able to be myself again because I do have a nice smile.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic is full mouth reconstruction. According to my first guest, no matter how bad your teeth are, or gums, there's always something that they can do. With us, we have Dr. John Minichetti. Okay, so you have lots of photos. So it's very common. People come in with like bleeding gums and bad breath, and they're losing their teeth.
Yeah.
Now, like you said, losing teeth is expensive. You're able to save a lot of people's teeth.
Oh, absolutely.
All the time.
That's our number one thing. If we could save someone's teeth, I obviously want to do that. We could do beautiful smile makeovers on natural teeth. If the foundation of the teeth are good and the periodontal health is good, why not keep your own teeth? You don't have to go to a center and have all your teeth removed. That's a thing that may keep patients away too, because they're nervous about it. So they should go to a facility where they can treat the teeth if necessary, if that's the best approach. Some of the studies now are actually showing that conventional dentistry may have the longevity as implants. Amongst dentists, there's philosophical differences whether you should remove all the teeth or not. If we could save teeth, it may not only be better for the patient in treatment, but it could save them a lot of money.
Okay.
So, some patients come to us, these ordinary patients. Here's a patient of ours, Howard.
All right.
Howard is missing one tooth. Unfortunately, he went to a facility that they did an implant twice, and I don't know what happened, but it did not work. It came to me, you're the expert. Can you put this implant here? Because he really didn't want to have his teeth filed down to make a bridge, a standard bridge, and he wasn't going to wear a removable. So I looked at it and did a CAT scan, and it looked fine. And I didn't understand why he had a difficulty. We replaced the implant. It was a simple procedure for him, cost effective. He's back in action. He's
So
smiling.
even if you're missing one tooth, get a dental implant over a bridge?
It's a great idea. Why would you grind down healthy teeth? There's no reason to do that. The grinding down of the teeth can cause root canal, a fracture, extraction, more implants. You could treat it
What
simply.
about expense, though?
Well, if you compare the two, you may actually save money by placing an implant, because in the long run, the implants may last longer than a conventional bridge. Those only last 7 to 10 years. You might get decay or need root canals afterwards. So you might as well be more conservative, not touch the teeth, damage the teeth, and save money in the
Okay,
long
good.
run.
Time for a couple more.
Couple more. We got Kathy. Kathy's awesome. Kathy, she's looking for a smile makeover. She's getting treated in another office. In fact, another case where the implant was placed in the improper position, I removed it, but we redesigned her smile. If you look at her, she's too gummy in her smile. It's an uneven look. Besides the crowns and veneers looking uncosmetic in the beginning. She wasn't happy with it at all. Afterwards, you could just see how that smile blends with her lip.
Very nice.
Just gently touches her lower lip. When she smiles, it goes right to the papilla. Those are the things that you look for in a cosmetic look. Another patient here, we have Jennifer. Well, here's a woman who comes in for a cosmetic consultation. She's unhappy with her smile. She feels like she doesn't show enough teeth. She's tried whitening them, and it really hasn't gotten any results.
Okay.
So we presented a better treatment plan for her, which was to give her a full mouth of veneers and crowns. And in that manner, we opened up her bite and gave her a color that's more natural but cosmetic. And she's really happy with her smile. She's now learning to smile more because she's been so used to hiding it like everyone else.
All right.
And really developing into a beautiful case. She's referred a couple of her friends to us. Here's another patient, Ricardo. Now, Ricardo comes in because he has a bridge that's failing. What's a bridge? It's on the teeth. And
So the front is a bridge. What we're looking
yeah,
at.
he's got a lot of decay on those teeth, and he's looking to change his smile. He's very unhappy with his smile. If you can see, he's way too toothy in the front. So unfortunately, we couldn't save the front teeth, but the back teeth we could save. I mean, there's no reason to remove all his teeth, which may have been done in some centers. So on the front, we put implants on a small bridge on implant, and in the back we crowned his teeth to develop a smile that looks more natural and symmetrical. Very, very happy with the smile. And it's kind of funny that we have this photo because that's not his typical smile, but in evaluating these cases afterwards,
So you told him to smile
Yeah,
really
we
big.
want him to stretch his lip as high as we can so we can evaluate where that gum line is.
So you got rid of that gummy part. What, do you laser it off? I mean, how do you get rid of that?
And actually, you can either, you can sometimes laser it off or do minor surgery, like minor plastic periodontal surgery.
Okay, and that's what you did?
Yes.
Okay, good. Now, we're out of time. And today we're talking about full mouth reconstruction. What do you say to the patient watching this? Maybe their teeth are really bad, the bleeding gums, the bad breath. Maybe they need to lose their teeth. But for whatever reason, they're still doing nothing.
Right.
And they're afraid of the dentist.
Right.
Or maybe they think it costs too much. What do you say to them? What's their first move?
I say the first move is to come in for a consultation. It never hurts to come in for a consultation. You can learn your options, and most of the time, it's not as bad as they think. They've been self-diagnosing themselves. They think they don't have enough bone. They think they don't have enough tooth structure to work with. They think they're too far gone. There's really very few patients we can't help. You know, it's not for everybody, but if you're not happy with your smile and you don't like the foods, or you can't eat the foods that you love, you should come in for a consult.
Do something about it.
Do something about it.
All right. I want to thank you for coming to the show. Very interesting. Also, they can go to your website.
Oh,
All this is
absolutely. On
there.
my website, they got the photos, we got pictures, information on all the techniques we use. Be glad. It's Englewood Dental. There we are.
So I want to thank you for coming to the show. Very good.
My pleasure.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.